What does it look like for you to actually help someone who has this grandiose sense of self? Like, how do you work with it in practice with your patients? Maybe you have an example that you could give us.
Yeah, so let me think. So here's another example, another way that this may present itself, and I think could probably a lot of people could relate to. So
Okay.
we spoke about the father, not being able to play. A lot of people could probably relate to being with someone who has an incapacity for playfulness, like they're very driven. So a lot of people are also with someone who maybe gets angry, right? Like if you make a request of them or you give them some kind of feedback, they blow up maybe in a fit of rage. So in this example, again, a hypothetical patient who comes in, like a prototypical patient, he gets a request at work, right? Someone calls and asks him to do something at work, which, by the way, is his job to be doing this at work. But he slams the phone down. He goes into a fit of rage, right? Now, the phone call requested that he do something, and on the surface, it might seem like an overreaction, like slamming the phone, cursing. But what's happening internally is far more complex. And as you know, Lisa, this is what we need to get to. Like what's going on inside of him. Just like we don't want to get caught up in the grandiose presentation, we don't want to get caught up in the angry presentation as well. At that moment, I could see it more like a smokescreen. So he begins to talk to me. The first order of business in terms of interventions and how I work with them, and I'm not going to go over this in detail because you and I covered this already, Lisa, and I would encourage anybody who's like watching or listening to go back and listen to any of the content on containment, right? Containment is just helping somebody get into a more regulated state. And that always has to be the initial intervention when somebody comes in so hot and angry like this. So what he ends up doing once the act of containment and I can help him turn an affect storm into just like a mild storm, right? So he begins to think and he starts to think about what it was like growing up. And he spoke about how he was someone who was capable when he was younger and was quite intelligent, but he felt like he never got the support that he needed. Now, this is really important because oftentimes patients or your partners may reflect back to childhood experiences and use it defensively. And what I mean by that is they don't use it to really understand something, but they could use it to blame a parent, for instance, why you are a certain way. So anytime a patient of mine goes back and starts reflecting on history, it's really important to help them connect the affect, that it's affectively alive. So with this fellow, as he goes back, and what we begin to discover is he was very intelligent, but then when the work in school became more demanding and required more of him, because he didn't have what he felt was the emotional support that he needed, that he was not able to perform. And this is like a litmus test. I sometimes sort of half joke about this, but in doing an assessment, I always wonder when someone excels academically or excels at work, I can ask them, well, how did you do in calculus? Or how did you do when it came to physics? And oftentimes that's where you see the first cracks with people who do have narcissistic traits. Why? Because they're not some of them are naturally intelligent and they could get so far without working and putting in effort and delaying gratification. So this is what he and I begin to talk about. And he said that he never felt like his parents saw him and he never felt supported by them. So slowly we begin to see that when he's at work years later and the phone rings and it's a request, it's a small one, but it demands the same kind of effort. Then suddenly, from childhood, believe it or not, yes, this stuff doesn't go away. A
Right.
helplessness, yeah, you know this, right, Lisa? It starts
Yes.
to come over. Yeah, yeah. Go ahead, please jump in. Were you
No,
thinking something?
no. Keep going.
Uh-huh.
Keep going.
So what we discover is the feeling isn't "I'll try," right? It's "I won't." I'm not doing this. But just beneath the surface, It's that I can't, and I'm all alone, and nobody's here to support me. And this is what we call psychic helplessness in my field, and that's too painful to endure. It's much more comfortable attacking somebody else or getting angry. At least then you feel in control. So beneath the protective shield now of this angry affective storm is a deeper, more painful feeling that we slowly come to discover of I'm all alone with no support. So that's just the sort of descriptive presentation, but it does speak to, in a way, right, Lisa, how I work with this, because one thing I said is the act of containment. The second thing is, from a psychodynamic perspective, not just buying into what I called the smoke screen a little bit earlier, the rage, but containing that and trying to understand in a more reflective way what's going on beneath the rage. So let me just pause there. Yeah, please jump in.
That was a really, really good, clearly articulated example.
Thank
And
you.
I think what happens is when the narcissist is slamming the phone down, there's really fear there too.
Yes.
A fear I'm not going to do it right, a fear that I'll be judged, a fear that I'll be abandoned in some kind of a way.
Yes. Yep. Absolutely. And during this initial pass, like if we follow this and we think of it like a process of change, that's good to keep in mind, right, Lisa? But to go back to what we said a moment ago, you don't want to label it just yet, unless he's close enough to it, right? If you could feel it in yourself, or that he's using words that suggest that it's close enough to awareness, then absolutely you could begin to make that, you can use that kind of intervention and reflect back, how he seems to be angry, but you're also wondering, is there something that is what? Scaring him about doing this project. So yeah, that's a reasonable way to go. So in terms of psychodynamic techniques, so one thing that we want to accomplish is, of course, self-reflection, which is what I'm mentioning. And the
Yes.
other thing is integration. And you may have heard me speak of this before, but if the underlying premise is that in a personality disorder there's a fragmented sense of self, this is the splitting, by the way, that we spoke about just a little bit earlier, which is a problem, of course, because when things get split off, they get projected. And then when they're projected, they're put on somebody else, and that's a whole different story. Again, this is just a plug for something that Lisa and I already spoke about, which is called the projective introjective malignant cycle. So we don't need to go over that again. But the goal then is integration. And this means helping the person become aware of and bring together these highly contradictory and often distorted internal representations. Now, what does that mean? I'll just say very quickly. It means the internal representations are the idealized. So now we're back to that, which I said is a part of the grandiosity. And that comes out with this little example of, like, I'm above this, or I'm not going to do this stupid project, or why can't, X, a colleague of his do the project, as if he's above it. There's the idealization, the idealized sense of self. And then, of course, the devalued, right? You want to bring these two together. What's the devalued? That's the images of himself of what? I'm all alone, or I'm afraid, to your point, Lisa, or that I can't do this, or that I don't have support, that I'm not capable, basically. That's a devalue. So when they're splitting, these two are very far away, and you only see one, the grandiosity, or the other, like with the more vulnerable narcissist, the I can't do this. So that's the second major goal of a psychodynamic approach, is slowly helping them bring these two together in a more integrated way, if that makes sense. And I could, of course, keep going, Lisa, but please feel
Yeah.
free. Mm-hmm.
You want to merge these different aspects of them together because the patient client themselves probably isn't even aware that they have these, split things going on inside of themselves. So how do you even begin to do that in therapy?
Yeah, so let me just say, you are right. They don't even know. They're not aware that they have it. And that's like, I don't want to say the beauty of splitting, But that's one of the ways it works, is
It
to
works.
really, yeah, sequester a whole side of yourself so that you're not even aware of it, right? But for anybody who's watching Severance, which is a TV show that came out recently, the whole premise of the show is based on splitting. And I won't go into the show in any detail, but the main point that they made quite nicely is that even when things get split off, they tend to make their way back into consciousness. So you can never really get rid of this stuff. Even though you're projecting, it still doesn't get rid of it. So anyway, that was a little bit of a digression, because sometimes when I watch TV, I love to analyze these things and the meaning of it, like from a psychodynamic perspective. But I'm sorry, Lisa, I digress. So the question was I'm sorry, I lost track of it.
That's okay. That's interesting. I haven't heard of that show, but I might look it up.
Yeah.
How do you even begin to start to do this in therapy? Like, you have to form a therapeutic alliance first, I would think. How can you talk to us about how you go about doing that with someone with NPD? And then how you start to kind of get these different facets of themselves to integrate. I'm sure that's a process. It's not a 1 or 2 session,
Yeah, that's right.
conclusion.
Yeah, right, because one thing is that they have to begin to develop what we call trust, like analytic trust, which means that there's a trusting person in the room, which implies there's another person in the room with them that they can hear. And that in itself is a process with anybody who has narcissistic characteristics. There's not oftentimes there are not even two people in the room. It's all about them. I think all of you know that, who are listening and watching. And
Yes.
so that's the first step, is building a trusting relationship where two people exist. But to do that, and I know, again, I promise I'm not going to go over this again, but that's the act of containment. That's like, in other words, we don't make these kinds of interventions early on, because someone will just get very upset. They'll think that you're crazy, like this guy, this example that I just gave. If I came right out and told him that you're angry because you're defending against being all alone in this project and feeling like you're not capable, he'd say, "What are you, crazy? That has nothing to do. I'm angry because they gave me all this work to do." You see,
Hmm.
because it's so far from their level of awareness, and that's the whole way the structure is set up. So it's set up perfectly to keep the more painful feelings away, but that does not mean we could just introduce them back in, because that would be very upsetting to them. So the first step is building this trust, and the way to build the trust is through the act of containment, demonstrating curiosity, interest, never judging. Like, you see, nothing to do. I'm not upset that he's angry and smashing his phone. I'm not judging him for that. I'm curious, and by being curious, I'm showing him I can tolerate this. It's not something to be embarrassed of. These are things we could talk about. So all of that is part of the process in terms of helping them not just become more self-reflective, not just to be able to reflect on their inner world, but to begin to begin to trust me as well, so that when we get to these higher level interventions, which are going to be necessary to begin to heal NPD, they could trust, so that when I do have a different opinion, or I do make a leap, like you mentioned like a moment ago, Lisa, about fear. Remember, I said if they're close enough to it, but they also have to trust you. Trust
Yeah.
something that's coming from you, right? So they don't just push it away. So all of these are sort of, not that I'm trying to be overly schematic, but there are steps that need to be taken. It's hard to just say, I'm going to do this, when this preliminary work has not yet, like, you need to build the foundation for someone to be able to hear you and have them be curious about what's going on, not only in their mind, but also in your mind as well, and to be able to work with you on that.
Yes, and that takes time.
Mm-hmm.
Um, so in the therapeutic sessions, what's it like? How is it different working with someone with NPD versus someone who maybe has a different diagnosis?
Oh, that's so interesting. That's a good question.
I know
So,
it's probably a complex one, but
yeah, but let me stay consistent with the answer, okay, since we're
okay.
here already. So one of the big differentiating factors with a personality disordered versus a non-personality disordered patient or partner, let's say, because again, we're thinking about everybody who's listening or watching, is when, let's just use an example of you're working on, like this, with this fellow who comes in and he's angry, right? Do you have a feeling that you're trying to work on something together? In other words, are you trying together to figure out his anger? That's one of the big differences. Like, so somebody with a personality disorder will come in with the expectation that you will solve this problem magically for them and quickly as well. You will give them the answers. Even though they can't hear the answers, we just said that a moment ago, that's irrelevant. They still want the answers. They don't want to think. Okay?
Can I pause you right there?
Yes, please.
That is interesting to me because if they have this grandiosity, how is it that they think another person could help them?
Mm-hmm.
They should be able to know to help themselves.
Yeah, that's right. That's right, Lisa. And it's such a paradox, right? Because
Right.
beyond the grandiosity, remember what makes up part of the grandiosity is the vulnerability.
Yes.
And even though they don't want to depend on anybody, guess why they don't want to depend on anybody? Because they have such dependency longings. They need somebody. But you'll
Fear.
never hear that. You know, you'll never hear that they have a longing to be close because you just always see the opposite. So they're there, so they do want the answers from you, right? But in a more magical way, where they feel very much taken care of. You see, there's the childhood stuff that we're not even getting into today. But something that went missing in early childhood is that really strong connection, the affect attunement, you know, someone being emotionally responsive to them, empathy, et cetera, et cetera. So anyway, to answer your question, yes, it is a paradox that they are looking for something, even though they think they have the answers. They do want something from you. But then once you give it to them, because it threatens now the grandiose sense of self, right? Then
Right.
it gets pushed away. And that's why oftentimes things don't change with these patients because they're rejecting. And there's the other big difference right there. So working with someone who's personality disordered versus not, someone who's not, there's more of a collaborative effort. We call this a therapeutic alliance, two people working together on a project, right? Instead of just save me or rescue me or take care of me. And then when there is an insight, when you do share something with them, they internalize it. They're able to take it in and think about it. Where somebody with a personality disorder, as we just mentioned a moment ago, may feel envious, you know, like that you have something that they don't have. And then therefore it needs to get rejected and pushed away. And these are all the things you need to be alert to because they may not overtly reject you. Some do, by the way. And they say, that's the stupidest interpretation I've ever heard. I'm better off watching Oprah. She's more intelligent than you. But some of them don't do that. But what you see is over time, nothing changes. And that's an indication that they're not really taking in and thinking about the work that's being done in the sessions.
Very good. I have one last question for you.
Okay.
What are the most common challenges that you faced in building trust and rapport with a narcissistic client?
Okay. Good.
Because
Another one. Yeah, go ahead, please.
in some ways, I'm thinking of someone who is more covert. They're seeking out the connection, but in someone who's more overt, they need it, but they're not going to let you know they need it.
Yes. Yeah, so just with the covert, I'll just share with you the way that I think about it is one of the main characteristics is they're very they devalue like in a very subtle way, like that's part of the covert as well, is they could compliment you in a way that you end up feeling so insulted. You know, like they may comment on how if you're wearing a short skirt, let's say in session, right, Lisa, how beautiful your legs look if it wasn't just that you didn't have all those varicose veins. You know, like something like that. I don't know. I'm not doing it justice. But these are the most challenging, in my opinion, like in terms of the different clusters of narcissism, these are the most challenging because they can become so dismissive of everything that you say. So in terms of one of the biggest challenges, that's it, is trying to connect to somebody who has such a need to devalue you over and over. Remember a moment ago I mentioned that they may not overtly reject my comments, but over time they're not changing. So with the covert narcissist, they're constantly devaluing you. So to make a connection with them and build that analytic trust is far more challenging. And that's where it comes to, like, again, I'm sorry I'm doing this, but it comes back to containment, right? Because containment isn't just taking things in passively. It's asking questions, but it's also confrontation, gentle confrontations. In terms of, like in this example, I would begin to explore how it is and why it is that it's so necessary to devalue me or to put me down or to reject me in that way, but in a way that's open to really thinking about it. Like, let's think together why it becomes so important for you to do it this way. But that, Lisa, leads into a whole nother set of interventions that I want to talk about with you, which I don't give them levels, but like these are like level 2, like more advanced level interventions. And I don't even want to call them interventions because we're also thinking about people who have these partners in their lives. But let's say more advanced, or let's say different ways to talk to people when you don't feel like you're really making a connection. But maybe we could save that because we have something upcoming. Is that right?
Yes, I think that over on my channel, we're going to continue this discussion,
Yes.
so people could follow over there if they're interested in hearing the rest of this.
Yeah, that's great. And we want to keep this going. I want to give more examples and be more, like, even more specific, like what we're doing right now, Lisa, but we're going to use a couple of other examples to show. So this way, everybody has a bunch different techniques or tools at their fingertips in ways that you can engage somebody like this in your life. So, Lisa, I want to extend a big thank you again for coming up with such thoughtful questions. You really give this a lot of thought and consideration, and I appreciate it. So I'm looking forward to continuing this conversation. So for the listeners, stay tuned. As always, I'll put the link below to Lisa's site. So if you want to if you want to continue to listen to this discussion, it will be below. Okay, everybody. Lisa, thank you
Thanks,
again.
thanks
Yes.
so much.
Okay, everybody. Bye for now.